Over the past few days, we've been hearing from nurses who have been overwhelmed in their intensive care units as COVID-19 cases continue to rise.
Yeah, and our three major hospital systems, they have been providing us with numbers, but they're for their combined ICU capacity, not individual breakdowns by hospital. Nabil Remadna digging into this issue, trying to get some answers for us, and joins us live from the Austin Convention Center. Good morning, Nabil.
Good morning, Tom and Sally. That's right. The city of Austin and Travis County expecting COVID-19 hospitalizations to overwhelm our area hospitals as soon as this week. That's why they're taking some action to make sure that those facilities have enough space. Now, one of the places that they'll be opening here at the Austin Convention Center, this will serve as a makeshift hospital. This hospital will help take in patients transferred from local hospitals. It will treat the less critical patients, freeing up more beds in our hospitals for COVID-19 patients. But as this happens, the mayor is calling for more transparency.
We have an uncontrolled spread of the virus right now.
The positivity rate for COVID-19 is skyrocketing in Travis County, and Mayor Adler expects things to get worse for our healthcare system.
And I am most concerned about the number of people that are in our ICUs.
We've had three nurses equally concerned reaching out to us from three different facilities. One who wished to remain anonymous said of an ICU, ours has been for a while now, overflowing to the surgery, holding area, and keeping sick ICU patients in the ER until we can make room. Morale isn't great.
The people you need to hear from and pay attention to are the doctors and the nurses that are in those facilities that right now are raising the alarm.
When an ICU fills up, the impact is not only to COVID patients.
It's somebody who has a heart attack in our city or is involved in an automobile accident.
We reached out to the healthcare systems in our area to find out if any individual hospitals' ICUs have reached capacity. The response we got: they don't believe it would be beneficial to share the information because it's constantly changing, and they want people to go to the nearest hospital when they need care.
I support total transparency, and I think it would be great if all the hospitals talked about what the numbers were in each of their individual locations.
The hospitals are required to report facility-specific information to the state, which informs this online dashboard that shows hospital data by region.
But the more information we get to the public, I think the better we are.
Now, on Friday, the three hospital systems sent out the latest numbers for ICU space, showing they had about 50 open beds. The state's website, however, shows that in our 11-county trauma service area, there are only 16 available beds. It's not possible to explain that discrepancy without better info from the hospitals and the state. Again, this is something we're continuing to monitor, the number of ICU beds that are available. Stick here with KXAN News. Those numbers hopefully will get updated here in the coming week. Guys, back to you.
Nabil Remadna live from the Alternative Care Center at the Austin Convention Center. Thanks, Nabil.